morning, Sarah. You are the founder and executive director of Total Health, the largest provider of free oncology medical and patient education in the United States. This is amazing. It's like amazing. It's started by a woman. And I'm looking forward to discussing your background, mission, and goals for Total Health. But can you tell us about your background and how you started Total Health?
Sure. Well, first, thank you for having me. I think women like you that give other women a platform to share their journey, their dreams, etc., it's so necessary, because I think so many of us as women, we suffer from thinking like, are we enough? Do we have what it takes? And when you see other people that look like you, sound like you, have the same questions about identity as you, it really motivates you to say like, yeah, I can do it. So I really just want to start by saying I appreciate so much the platform and the opportunity to talk with you.
It's my pleasure.
I started Total Health really because I saw a need. I saw a gap in the way people that treated cancer were being educated. And I thought I could do something better. I could do something different. I can kind of create a niche market that allowed physicians, nurses, advanced practice practitioners in clinical practice and cancer care the opportunity to start to work with programs that catered to exactly the way they liked to learn. And so I really just kind of held my breath and took a dive and said, this is what I want to do. What qualified me to do it is I started my career in cancer about 16 years ago as a researcher at the University of Miami, and I worked predominantly in breast cancer. So I knew how the clinic operated. I then moved into pharmaceutical and diagnostic sales. So I started to see how people in the community wanted to be communicated with. And it gave me a unique perspective to be able to think about the way to design medical education programs to reach those various audiences.
So now, I know you started 16 years ago, but let's go back before that 16 years. What were you doing? Or did you ever wanted to think like, hey, I'm going to start working in something like that, or even start working with the university or anything like that at all? Is that something you're passionate about, or the switch happened in school?
Sure. Like you, my career path and really what motivates me for the steps I take are so heavily influenced by my family, by my upbringing, really by my culture. And I know that'll resonate with you because my mother is a Trinidadian nurse who studied nursing in England before coming to the United States. And my father was an Irishman born in England who trained to be a doctor late in life. And all my life, I really was taught that we kind of have to be mission-minded. We have to think about our service, not just to ourselves and to our immediate family, but really to the communities around us, to people that don't necessarily have the same accesses that we have. So from a young age, I had this entrepreneurial spirit that said, if there's a way for me to do something and do something better, I can find that courage and innovation to get it done.
And you just went for it.
I just went for it.
So now, Total Health, can you tell us about the organization itself? What is it about? And then the services, and how does it help people?
Sure. So we are, as you said in the intro, the largest provider of free oncology medical education in the United States. That banner that we carry is 7 years in the making. So when we started, we were just a tiny boutique programs company. We knew that we had the ability to reach the audiences, but we wanted to reach them in a really intimate way with such a unique attention to detail, a woman's touch, because this is a male-dominated industry. So we like we thought of everything, flowers on the table, the way we greet people, the way we say welcome. So many things kind of became inviting. And COVID allowed us to turn the corner from being a small medical education company really to a large medical education company and beginning to scratch the surface of a global audience. The idea that people had to log in instead of show up physically opened the doors of things I never would have thought of. And I think that resonates with a lot of industries, but we provide medical education that changes practice, that reaches physicians to influence the way they care for patients with cancer, that reaches nurses in a way that allows them to support the healthcare team for the patients at their most vulnerable time. So we continue to carry that as our core value. How do we affect patient care, and how do we do it uniquely and in a way that invites people to listen, to learn, and to want to come back?
So the company focuses just on the provider, like teaching the teams and how do they care, but not actually with the patient themselves.
So I love that you say that, because about 5 years ago, I was diagnosed with an autoimmune disease. And until then, the impact of the way you live with disease was very arm's length to me. I knew how patients lived because I experienced it in clinic, but I didn't know how patients lived because it didn't touch my household. So when it did, and I was told by the doctor that, I said, okay, well, how do we treat this? How do we cure it? How do I go forward from here? And the doctor said to me, this is a lifelong condition. This will be what you carry the rest of your life. And it's chronic pain, and it's chronic fatigue, and it's a degeneration of the structure of my bones. So I can't tell you what that did to shift my focus from physicians and nurses to giving the patient a voice in their care. I became the patient. Different name of the disease, but an interaction or collision with something that made me, in my mind at the time, vulnerable. And it was like, it goes back to our mission, knowledge is power. If I could give myself what I needed, I could affect the way I live. And that's what we started to introduce in our programs. And that's still what we purpose for. We intentionally design programs that focus on the patient voice and include the patient voice in the programs we deliver to affect their care.
So how are you feeling now?
Well, some days are good. Some days are hard. I'm blessed every day. Every day that my eyes open, I'm blessed, because I believe that I've been trusted with this disease. I believe that in many cases, we think that we're burdened with something when really it becomes a catalyst for change. You see this all over the cancer community. People are diagnosed with sometimes metastatic disease. They're dying. And they decide, what I want to do with the rest of my life is serve others. And these amazing foundations are formed, and advocacy organizations are formed, and big research initiatives are kind of moved. I feel like that's why God trusted me with what he gave me. And I'm grateful every day to be able to impact patient care in what I believe is a significant way.
All I can say, Sarah, is that God gives it to you so that you can help others.
Yes.
And you are doing just that.
Yes. Thank you.
So now with cancer, is it any type of cancer, or did the company focus just in breast cancer?
Nope, it's all cancers. There's, the one thing about cancer is even within breast cancer, it's multiple diseases. We think we're learning a lot about, even within multiple diseases, it's multiple disease experiences based on the different types of people. For instance, in Black breast cancer, a Black woman diagnosed with an early breast cancer has a different outcome than a white woman diagnosed with an early breast cancer. We're starting to ask the question, Is it the biology of the tumor? Is it
Yeah.
the woman's environment? And so we're really moving closer and closer to not just precision therapy, but precision treatment planning so that we consider all of these things. But the company is focused on all cancers and hematological malignancies, so cancers associated with the blood. It allows us to really touch the cancer community and the community oncologist in ways that he or she experiences their day. There's a total health program really designed for every patient that walks into the practice.
I love that. Every patient. I love it, the way you said it. Every. So you're not leaving anyone behind.
No one.
So now, can you share with us your mission and goals for total health? Let's say that's 10 years from now. What do you envision for it?
Wow, that's a good and big question. I love it because it's a dreamer's question. You know, so many times we think we know what we want. We think we know what's possible. You know, we start with this construct of like, what can I do? And I think we really have to shift to start asking the question, what needs to be done? And back that into who needs to be part of the team to get there. So as Total Health continues to evolve, I wish I could say that this was my plan from the beginning to become the largest provider of free oncology information in the United States. So what's next? We've got to start giving a voice to the invisible. We've got to start getting angry about the disparities in care, about the differences in access between demographics. We've got to stop thinking that we know everything about everything and really start asking the communities, especially communities of color, what do you need? How do you want to be taught? How do you communicate with your family? Because if we eliminate the culture question, we're not doing justice to the solution. We've got to start being transformative in the way that we think. And I think Total Health is in a position to unite the various audiences, those expert voices from the top at podium, the community oncologists and care teams that treat the patients where they live, and then the patients themselves. I really believe knowledge is power. If we empower people with the information they need to make decisions contributing to their care, they live better. And I think that has to be an across the board knowledge is power, not just for those who can easily access it.
I agree with you on that, but and also that I love the fact that you are focusing on the patient voice. What do they want? What they're looking for? Instead of us making decision for them, thinking, "Hey, that's what they want. Well, let's give them this and that." But in reality, that's not really what's going on. For me, the way I see it is that it's your body. You know how you feel. You know what's going on there every single day. When you wake up, when you go to sleep, when you eat, when you go for a walk, you know what's going on. So you know what's best for yourself. So
Yes.
someone else making the decision for you is completely wrong. So I like where you want to take the path you want to take it, because I think it's going to focus on people first. Before that, we think about anything else in the world.
Yes.
And I'm grateful to just be a part of it, just a tiny little part, by just having this conversation with you.
Yes. I mean, using platforms like yours, you remember we tend to think of cancer education as, you know, where do you go after you're diagnosed? But the reality is we've got to start earlier. You know, we've
Yes.
got to start in screening. We've got to start in prevention. We've got to start being able to have comfortable conversations with our kids.
Yes.
This is where change happens in the home. You know, being able to have informed decisions. And so platforms like yours that don't necessarily have cancer as their core value, this is where you get to reach the people that can make the change before a cancer is even diagnosed. So I really appreciate the ability to speak not only on leadership, but on educating and informing and really empowering your audience to be able to understand their options, not just for care, but for screening and prevention.
Exactly. Thank you, Sarah. I appreciate it. So, can you tell us about your own personal connection to the cancer care community and how your own experience have influenced your work with total health?
Sure. So I mentioned a little bit about my mom and dad and then my own journey with autoimmune disease. But from the youngest age, I have a 19-year-old boy who's in college in Austin, Texas, and I have an 8-year-old boy who's here home with me. And at his age, I would every summer begin to help my parents pack mission medicine kits. As I mentioned, my mom is from an island in the Caribbean called Trinidad. And my dad found early on that he could use his skills, training, expertise, and connections to develop mission medicine programs all over the Caribbean. So I remember, as other kids were getting ready to go to camp and learn to swim and, play football and all of these wonderful things, I was getting to do at the time less fun things, but now looking back, so hugely impactful things at such a young age. And we would travel to these small countries and we would see people very, very, very slim resources. Forget about education, just resources. And they were sick. And it was like we had something to give. And so my journey doesn't necessarily root in that I had a grandmother who passed away from breast cancer. It roots in that I grew up seeing inequities in care. And I thought from an extremely early age, I can do something about that. And the rest of my life put me in positions where cancer became not just a focus, but a passion.
Just you had great parents, I have to
I had
say.
great parents. I did. I did. I do. My mom is still such a driving force in my life. She's 75 years young.
Oh yes.
She's more, I always tell her she has a more social life than me. She's so active in her church community. Talk about a woman leader. Raised 4 kids. Always had others in mind. So I not only had great parents, but I had great role models in both of them.
It's always it's amazing to see. It always start with at home.
Yes.
So it doesn't matter how life shake you, but something always start from where you were born, where you were raised. It start at home.
Yes.
So, well, all I can say is if your mom ever listened to this, thank you, mom. Okay, so can you speak about the partnership Total Health has formed with other respected cancer providers and education and advocacy organization, and the impact this partnership have in your mission and goals?
Sure. Partnerships are how we achieve our goals. I really believe that. I just had a conversation with someone that my biggest fear about the next generation is that they're so identity focused, which in so many ways is big and beautiful, right? Like they know who they are early. They know who they are early. And I feel like my generation, we waited for different things to shape who we would become. I think the risk there is when your mission or your goals are rooted in identity, when things come up in life that impact your point of view about that identity, you're derailed easily. When you are mission focused, when you have your eye on the prize of the finish line, whatever that might look like, you own a clothing boutique, you make sweet treats, you run a cancer education organization, a magazine. When you have the mission in mind, on your hardest days, you have something to look forward to. The days where you say, who am I to be doing this? It doesn't matter as much as, well, I got to put one shoe on and the next shoe on and get up and do it. Partnerships have become central to what total health conferencing is good at. For instance, there was a recent article on that kind of diminished the power of colonoscopies. It was like, it came out and it became a headline. Are colonoscopies necessary? within days, we were able to call one of the largest organizations in the United States, the Colorectal Cancer Alliance, run by Mike Sapienza, who lost his mom to a preventable colon cancer. We were able to contact a thought leader, Aparna Parikh at Mass General Hospital, one of the nation's leading cancer organizations, and say, let's do a patient-focused podcast. Let's make sure that our physicians know how to drive the point home that colonoscopies have the ability not just to give you an earlier diagnosis of colon cancer, but to actually prevent colon cancer by identifying risk, polyps, things of risk, and remove them. Partnerships are vital when you're trying to do big work. And I'm so grateful that we have some of the strongest partnerships in medical education and cancer, really in the United States.
Wow. So what's your next partnership?
Oh my goodness. Girl, let me tell you, I have this heart song for the statistic I brought up earlier. I didn't even define how worse an outcome a Black woman with early breast cancer has. It's 40% worse. It's unacceptable. And so the next partnerships for me in my mind are working with grassroots organizations to reach communities of color so that there are transparent, trustworthy, robust conversations going on that says, we demand more. There was a big movement, I can't even tell you the year, but this movement that said, we don't see color. That's kind of, we don't see color. In this case, you must see color. If you are not having conversations with that younger Black woman diagnosed with breast cancer in your clinic, you're already beginning to fail her. So for me, that's what's next, not just for total health, but I think really for the cancer community. We've got to start seeing the underrepresented. People said we've got to start seeing minorities. Well, minorities are now becoming the majority. So if we're failing this majority population, Blacks, Hispanics, Asians, Pacific Islanders, people of mixed race in the United States and globally, we can't be happy about the advancements we're making in medicine.
So now, can you discuss any unique or let's say innovative programs or services that Total Health offers to its patients and their families?
Yeah, a few years ago, we started a program with Dr. Reshma Matani of Baptist Health here in South Florida called Empower. And we kind of decided it's going to be patients. We're inviting patients that lived with or through breast cancer. And we're going to have a day that not only celebrates them, like a lot of advocacy organizations have wonderful events that celebrate your journey with or through cancer. We are going to have a meeting that empowers patients to be able to speak to a multidisciplinary team that includes your oncologist, your surgeon, your radiation oncologist, your radiologist, your social worker, your survivor clinic representative, just all facets of who touched you during your journey, and celebrate that we could empower you with information. It was and continues to be my favorite meeting on the calendar. It was such enormous impact to the patient community. And what came out of that was a need to focus on taking what is presented at podium and turning it into plain language summaries available on our website that patients could print, discuss with their physicians, discuss with their families, and choose how deep they wanted to get to be able to understand shared decision making. So I'm excited about what we do for patients. We've got to do more, and we're focusing on that. But these two things really are the right steps in the right direction.
But Sarah, you are already doing a lot. A lot of time that sometimes we think we need to cover everything in life.
Yeah.
to do a lot. But in reality, as humans, sometimes all we need from someone is to listen,
Yes.
just to listen. And
Yes.
that is one of the most important thing. Like my grandpa used to always say to me, if you be quiet for a second and you listen to your surrounding, you will realize the universe itself always talking to you.
Oh,
But
yes.
you can hear it because you're always talking. You never
Yes.
stop talking.
Yes.
So that is one of the issues that we face even with the big corporations and all these big things going on. They don't listen. They
Yeah.
just talk. And we never can talk. So they just listen to themselves talking and make the decision.
Yes.
But
It's like an echo chamber. Yes, you're right. You're right. You're right. This is where you've got to strike the balance, because there is so much noise out there. And I think one of the things that we're charged with is making sure that we can cut through that noise and give reliable information, data-driven information, trustworthy information. So again, thinking, if you are a woman diagnosed with breast cancer and people say, you caught it early, your outcomes are great. That's not universal. You have to be able to empower people with the information to make the right next decision. And I think you're 100% right. We've got to listen. We've got to get in the position and in the seat of listening, because we're so used to, especially in education, talking. You think of your teacher. The teacher talks and the students listen and learn. We've got to move into this new world of let's talk with each other. Let's talk to each other, not at each other. So I think your grandpa had it right when he said, you learn so much more when you're in tune with the surroundings, when you get to sit back and absorb what's happening
yes,
around you. It gives rise to the right questions to ask. So yes, I hear you 100%. It's difficult because there's such an urgency. People are living with a disease that they're still succumbing to. There's an urgency to get the right information to the right audience so that the intervention can be something that allows them to attend their daughter's wedding, to hold their grandkids, to go to that high school reunion, college reunion, live those extra days and live them well. So
yes.
balancing the urgency of getting the information out with the responsibility of how much information we get out, you're absolutely right. There's got to be a consistent focus on finding the right cadence and finding the right volume of noise we put out there.
Absolutely. So now you being seeing so many patients, women, diagnosis, let's just focus on women for a second, diagnosis with breast cancer or any other type of cancer. So now any advice that you have for women going through that tough time right now, that think that this is it for me and I'm going to leave my family. This is it for me. I didn't get a chance to do what I wanted to do in this world. Any advice you have for them?
Yeah, you always want to be human first, right? We're humans first. Then you start to think about all of the other dynamics you are. You're a mom. In my case, I'm a woman, I'm a mom, I'm a wife, I'm an educator, I'm an advocate, I am a business owner. There's so many dimensions. There's so many roles, hats we wear. One of the things I love about you and the content you put out is this mompreneur. How do you balance the responsibilities and the giftings you have at home with the responsibilities and your gifting in the workplace? The advice to women, the advice to people that are living through, with, and after a diagnosis of cancer is: number one, information is power. Be informed. You have a seat at the table of your care. Don't wait for someone to tell you what's best for you. Understand what questions to ask about what's best for you. Number one piece of advice. Number two piece of advice: take your time. Don't get consumed in the diagnosis. Stop every day to focus on the other things that you would have been focused on if you didn't collide with a cancer diagnosis. Because none of us know our last days. You and I could be sitting here today and you have a cancer diagnosis and I don't, but the Lord takes me in a car traffic accident. None of us know our last days. Live intentionally. Really, probably my best piece of advice for someone who has been given a diagnosis is, and maybe it's a terminal diagnosis, always leave the light on for hope. There are stories upon stories upon stories of people that get up and say, my doctor said 6 more months, and here I am 17 years later. No one can put the time we're taking on you. Don't accept it. In fact, I would go a step further. Reject it. And live intentionally and fully. To me, that's the way we should be living with or without a diagnosis, because as I was reminded recently, from the time we're born, we're all terminal. We've got to start living our life this way. And I believe that the things that we do day to day that have impact on our greater community only enriches the time that we have here. So those would be my 3 top takeaways to people who are living with or through a cancer diagnosis.
Thank you. Thank you for sharing that. How can anyone reach out to you for help, for support, for guidance?
Sure. So we are a cancer education and information company. We primarily train the healthcare provider, but as I mentioned, we have a lot of patient resources and a lot of patient resource partnerships. So we may not be the person that helps you understand your breast cancer, but we can point you to Living Beyond Breast Cancer or breastcancer.org or prostate cancer, Zero Prostate Cancer, an organization that is fully devoted to helping people through the journey. Or as I mentioned earlier, the Colorectal Cancer Alliance. There's always major organizations ready to help you. But starting at a place of totalhealthconferencing.com can get you to the right contact to open the door of what's next for you. Also, I started getting really active on social, specifically on LinkedIn recently, because I feel like that's where the community connections can be most easily made. I won't know what other people are doing unless I seek it out.
Yes.
So I have a LinkedIn profile under my own name, Sarah Louden. I also have one for the company, Total Health Conferencing. Feel free to follow both. But really, it's a place where you're going to get information about your journey with disease, information about being a woman leader, and really just information about living the lifestyle that you want to design for yourself to be a person of impact. So we'd love to have you follow us. We'd love to have you connect with us. And we'd love to be a resource however we may be.
Anything else you'd like to share with us before I let you go today?
Yeah, I just want to share, especially to the women leaders, because I know that's what you focus on. Don't ever stop, right? You have the idea. Take the first step. And once you take that first step, keep stepping. The map isn't clear. The destination isn't marked, but enjoy the step-by-step evolution of who you will become when you let courage guide your idea. Be mission-minded. Allow the world and your experiences to define who you will become. But don't think who you are today is what's going to get you to what's next, because we are always growing. So my biggest takeaway, no matter what, a patient living through disease, a doctor treating patients, a woman with an idea, or a woman 30 years into your career, don't let fear guide you. Step forward confidently. You have something to give.
Don't let fear guide you. Best advice ever. Thank you so much, Sarah. I appreciate the time, the knowledge, the vibe, the positive, because we can use that every single day. God knows what's going on in this world. So I appreciate what you are doing, the support you are giving, not just to women, to people in the world, to let them know that it's okay. You are not alone. We are
Yes.
here, we are working, we are listening to your voice. We got you. And we need to know that. Yes, we need to know that, and I appreciate it.
Yes. Thank you so much. Thank you for the opportunity, and I loved our time together.